Hey everyone, welcome to another explainer. I am absolutely thrilled to have you here today because, honestly, we're going on a fascinating journey that might just dismantle literally everything you thought you knew about gut health. If you've ever struggled with digestive issues, you've undoubtedly been told the ultimate golden rule of gastroenterology: just eat more fiber. I mean, it's on cereal boxes, it's in all the diet guidelines, and it's basically treated as medical gospel at this point. But what if the very thing you're using to try and fix your digestive system is actually the main culprit behind all your discomfort? Today, we're looking at some truly groundbreaking clinical data that turns the traditional high-fiber narrative completely upside down.
Okay, let's dive into this. It's a question that creates some serious cognitive dissonance, right? We've been conditioned since, well, the 1970s really, to believe that dietary fiber is the ultimate end-all be-all remedy for constipation. But have you ever noticed that sometimes the more salads and bran you eat, the more bloated, backed up, and just completely uncomfortable you feel? Well, you're not alone, and you're definitely not imagining it. We're going to look at three incredible sources today: a bombshell clinical study that actually tested a zero-fiber diet, a brand new 2024 PhD thesis on specific high-fiber foods, and some crucial clinical insights into bacterial overgrowth.
All right, Section 1, when zero fiber works best.
To really wrap our heads around this, we have to travel back to a 2012 study published in the World Journal of Gastroenterology. Researchers took 63 patients dealing with idiopathic constipation, which basically just means constipation with no underlying structural cause, and they put them on a strict, completely zero-fiber diet for 2 solid weeks. Imagine that for a second. No veggies, no fruits, no whole grains whatsoever. Just clear soups, white rice, and proteins. After those 2 weeks, the patients actually got to choose their preferred diet going forward, and then they were monitored for 6 months.
And this brilliantly illustrates just how staggering the results of that study were, especially when it came to bloating. Notice the data for the high-fiber group. Of the patients who went back to their normal high-fiber diet, 100% of them continued to suffer from abdominal bloating, literally every single one. But take a look at the zero-fiber group. 0%. The patients who completely stopped eating fiber experienced a total 100% resolution of their bloating symptoms. And those who just reduced their fiber intake, their symptoms dropped to about 31%. This direct correlation is absolutely fascinating, and it completely contradicts standard dietary advice.
But what about actually, going to the bathroom? Well, the straining data is even more incredible. Once again, 100% of the high-fiber group continued to experience straining. But for the zero-fiber group, those symptoms completely vanished. In fact, before the diet, these patients were averaging just 1 bowel movement every 3.5 days or so. When they stopped eating fiber completely, their frequency jumped to 1 motion every single day. And the folks on reduced fiber averaged a bowel movement roughly every 2 days. It turns out stopping the fiber actually cured the constipation.
Let's move on to Section 2, the traffic jam analogy. Now, you might be wondering, how on earth does eating less fiber result in more bowel movements? It feels completely backward, right? But the researchers provided an analogy that makes perfect logical sense. They wrote, "The role of dietary fiber in constipation is analogous to cars in traffic congestion. Think of a constipated colon like a highway backed up with bumper-to-bumper traffic. Constipation isn't a failure to create stool. It's a difficulty in evacuating a rectum that is already packed full. Dietary fiber acts as a bulking agent. So if you add more bulky fiber to a colon that's already struggling to pass what's inside, you aren't clearing the road. You are literally just adding more cars to the traffic jam. By removing the fiber entirely, the fecal bulk and volume actually decreased, which allowed the patients to easily pass smaller, thinner stools without all that straining."
Up next, Section 3, not all fiber is equal.
Now, before you go and throw away every single vegetable in your refrigerator, we need to introduce some crucial nuance here. Fiber isn't entirely bad across the board, but the type of fiber matters immensely. Let's look at some fresh data to build on this. This comes from a 2024 PhD thesis out of the University of Otago by Jasjot Mago. This research specifically set out to test the idea that different high-fiber foods have wildly different effects on our GI tract.
The study contrasted 2 very different high-fiber interventions. On one side, they tested defatted rice bran, which was baked into fortified bread. On the other side, they tested whole green kiwi fruit, and the results were super telling. While the rice bran bread successfully increased the daily fiber intake of the participants, it showed absolutely zero change in their bowel habits, their symptoms, or their transit time. It essentially did nothing at all for their gut function. The green kiwi fruit, however, completely different story.
The magic number here is 2. The study found that consuming just 2 green kiwi fruit daily was linked to highly effective laxative effects. More specifically, it significantly improved abdominal pain in folks suffering from constipation-predominant irritable bowel syndrome. See, the kiwi fruit increased colonic water content, meaning it actually helped hydrate things in the ascending colon, making it way easier to pass without simply adding dry bulk like that grain-based fiber did.
Which brings us to Section 4, the SIBO complication. This brings us to another massive piece of the gut health puzzle, and it explains why some people react so violently to seemingly healthy foods. We need to talk about SIBO, which stands for small intestinal bacterial overgrowth. Basically, it's a condition where bacteria from your large intestine migrate up and overpopulate your small intestine where they really shouldn't be. To understand how fiber interacts with SIBO, we've got to define the two main types of fiber. You have insoluble fiber made of cellulose. That's the structure material of plants, so think the roughage in a raw salad. And then you have soluble fiber, made mostly of pectins, which binds to water. Think of the sticky, gooey texture of oatmeal or ground flax seeds.
So why is fiber such a double-edged sword for someone dealing with SIBO? Well, first off, the cellulose and insoluble fiber is actually just chains of pure sugar. Our human enzymes can't break those bonds, but the overgrown bacteria in a SIBO patient's gut absolutely can. When you eat a big, raw salad, you are practically throwing a massive banquet for the very bacteria causing your bloating. Plus, that rough, insoluble fiber can physically scrape and damage a sensitive intestinal lining. On the flip side, soluble fiber also feeds these bacteria, creating excess hydrogen, methane, and carbon dioxide gases. All that gas gets trapped in your digestive tract and causes some pretty severe pain.
So the crucial point is understanding what we call the oatmeal effect. While soluble fiber gets praised a lot because it binds to water, it can actually backfire big time. Imagine leaving a bowl of cooked oatmeal just sitting on your kitchen counter. Initially, it's this soft, hydrated gel, but leave it there for a few hours, and as the water evaporates, it turns into hard, crusty cement, right? Well, the exact same process happens in your digestive tract. Soluble fiber can bind to water initially, but as it slowly transits through the small intestine and into the large bowel, it can lose that water. If your transit time is slow, which is super common in SIBO, that fiber dries out, turning rock hard inside your colon and drastically increasing your risk of severe constipation.
Let's wrap things up with Section 5, a nuanced gut check.
Okay, we have covered a ton of ground here today, moving from zero-fiber diets to the delicate chemistry of kiwi fruit and bacterial overgrowth. Let's pull this all together. Managing gut health isn't about blind adherence to a catchy dietary slogan. It requires a really structured, nuanced approach. Step 1. We absolutely must challenge the blanket rule that more fiber is always better. If you are chronically constipated, adding bulk might be the exact wrong move for you. Step 2. Differentiate your fiber sources. As we saw from the Autogo thesis, grain-based fiber like rice bran might just sit uselessly in your gut, while water-retaining fiber from, say, 2 daily green kiwi fruit can actively improve motility and reduce pain. And Step 3. Always account for the state of your microbiome. If you have SIBO, feeding those bacteria with raw salads and complex carbs is just going to generate painful gas and slow your digestion down even further. I want to leave you with this final provocative question to ponder the next time you're looking down at your plate. Are you eating that high-fiber meal because it's actively healing your unique gut profile? Are you blindly following outdated advice and just adding more cars to an already agonizing traffic jam? Finding the right path requires really listening to your body and respecting the science, not just the slogans.
Like, share, and subscribe. Press the bell icon for more useful explainers. And be sure to visit our clinic for any physical therapy and emergency pain relief treatments. Thank you so much for joining us. You can find more info at dgpc.uneweb.com.